Hello and happy day. How does slowing down sound to you today? Would you like to reduce the noise for just a bit? Are you ready to make a choice and decide to listen? My name is Igor S.F. Walker, and I am here to remind people to slow down, to reduce the noise, to walk their lives into a natural flow. Welcome back to the Book of the Week series. Every week, as I read another amazing title, I share it with the world. Today, we look at Reality Therapy, a new approach to psychiatry by WilliamGlasser, MD. Responsibility, a concept basic to reality therapy, is defined as the ability to fulfill one's needs and to do so in a way that does not deprive others of the ability to fulfill their needs. A responsible person also does that which gives him or her a feeling of self-worth and a feeling that he or she is worthwhile to others. Action can be called realistic or unrealistic only when its remote as well as immediate consequences are taken into consideration and compared, weighed. If the evil, pain, or suffering which ultimately occurs as a result of a given action exceeds the immediate satisfaction which it produced, that action may be termed unrealistic. Whereas if the satisfaction which ultimately occurs as a result of an action is greater than the immediate effort or sacrifice associated with it, such an action can be called realistic. In the final analysis, it is the capacity to choose wisely between these two types of behavior that we call reason. And it is what characterizes truly educated men, one who knows and can properly appraise the consequences of own actions. It is generally accepted that all humans have the same physiological and psychological needs. Competent people may describe or label these needs differently, but no one seriously disputes that in all cultures and in all degrees of civilization, men have the same essential needs. It is also generally accepted that needs do not vary with age, sex, or race. A Chinese infant girl has the same needs as a Swedish king does. The fulfillment of the physiological needs for food, warmth, rest rarely are the concern of the psychiatry. Psychiatry must be concerned with two basic psychological needs: the need to love and be loved, and the need to feel that we are worthwhile to ourselves and to others. Helping patients fulfill these two needs is the basis of reality therapy. Happiness occurs when we are willing to take responsibility for our behavior. Irresponsible people, always seeking to gain happiness without assuming responsibility, find only brief periods of joy, but not the deep, seated satisfaction which occurs when we behave responsibly. See, an immediate assured source of pleasure is never willingly given up for a larger but uncertain remote satisfaction. The job of a great therapist is to become involved with the patient and then get them to face reality. When confronted with reality by the therapist with whom the person is involved, that person is forced again and again and again to decide whether or not they do wish to take the responsible path. Reality might be painful, it might be harsh, it might even be dangerous, but it does change slowly. All any man can hope to do is to struggle with it in a responsible way by doing right and enjoying the pleasure or suffering the pain that may follow. Unfortunately for taxpayers, as well as patients, almost all teachings of psychiatry, psychology, and social work follows traditional thinking that considers the diagnosis of a mental illness to be essential to successful treatment. Millions of dollars are spent annually in an attempt to diagnose types of mental illness in the vain hope that the diagnosis may be helpful in treatment. All too common of an event is where you can hear residents argue whether a certain patient is neurotic because he fears to leave the house, or psychotic because he imagines that an unseen enemy will attack him if he steps outside the door. In either case, this person suffers from the inability to fulfill their needs. Whether they're afraid of reality, conventionally described as neurotic, or denies reality, conventionally described as psychotic, makes little difference in his life and no difference in treatment. The argument over labels helps no one. Patients have been treated with conventional psychiatry until they know the unconscious reason for every move they make, but they still do not change, because knowing the reason does not lead to fulfilling the needs. It is wishful thinking to believe that a man would give up a phobia once he understands either its origins or the current representation of its origin in the transference relationship. He continues to have the phobia because of some present irresponsible behavior. It may or may not be directly related to the origin of the phobia. When a person acts in such a way, they give and receive love and feel worthwhile to self and to others. This person's behavior is right or moral. Let's start focusing more on moral behavior, on responsible behavior, and human need psychology and how we satisfy these needs, instead of focusing on labels, dealing with nothing more than symptoms. Please do help out. It is easy. Simply like this video so more people can enjoy it. Share it too and spread the word. Subscribe to my channel and stay up to date, and link to this book is in the description below. So buy it and read. Never stop learning. Thank you. Love and respect.